Good morning, colleagues, staff. Welcome to today's Committee of the Whole. My name is Tim McGonigal. I'm the chair of the Committee of the Whole, at least for today until the chair makes her new appointments. First of all, I would like to acknowledge with gratitude that the CBRD is on the unceded territories of the Quw'utsun, Malahat, Subasit, Halalt, Penelakut, Snaminas, Layaxan, Pakwitchin, Dididot, and Pachidot nations, whose people have walked gently here for thousands of years. With that, I see Director Wilson online. If you can use your virtual hand, should you want to ask a question or have some input, I'd appreciate that. I have many people watching for those hands, and they will let me know when someone has a question or comment. Pardon me? Allison Nicholson, Director Nicholson, you're also online. Likewise as well, please.
To Chair, but my camera's black for some reason. I will fix that.
And Director Acton, thank you. Is there anyone here live? Director Staples also virtually. With that, Ms. Boyd, I will turn to you.
Thank you, Chair.
And Director Martman. Thank you.
Sure. Okay, all those guys online, raise your hand, virtually. Thank you.
Thank you, Chair. May I please have a motion to approve the agenda?
Do I have a mover and a seconder? All in favor? Opposed, if any? That motion carries. Thank you.
Thank you. Moving to adoption of the minutes, that the minutes of the Committee of the Whole meeting of November 13th, 2024 be adopted.
Director Martman, any errors or omissions?
Not yet.
Thank you.
Thank
Looking
you.
for a mover. Moved and seconded. Discussion? All those in favor? Opposed, if any? That motion carries.
Thank you, Chair. Moving, no business arising from the minutes, we'll move to the public input period. The public input period is to offer the public an opportunity to comment on any agenda items before the committee considers them. The public input period procedure policy allows for an allotment of 15 minutes where the speaker is welcome to comment on any items on the agenda up to a maximum of 3 minutes. This excludes items that are or have been subject to a public hearing. Input from the community is valued and appreciated. We request that input is presented in a friendly and respectful manner. Your cooperation in maintaining a safe, respectful, and orderly environment is greatly appreciated.
In other words, as past Chair Stone would say, let's be nice. I don't see anyone stepping to the podium, Ms. Boyd. We can carry on.
Thank you, Chair. We'll move to delegation. We have Wesley Davison, the Chief Project Officer of Island Health for Cowichan District Hospital Replacement Project. This is the update on the progress of the Cowichan District Hospital Replacement Project.
Good morning, sir.
Good morning. Can everyone hear me if I put the mic there? Yeah. Thank you for having us back. Firstly, we'd like to acknowledge, try that again. Firstly, we'd like to humbly acknowledge that we respectfully are building the hospital on the unceded, unsurrendered territories of the Cowichan tribes, the Cowichan people who have stewarded this land for eons. And we also support the other nations in and around the Cowichan Valley, including the Diddidat, Pachidat, Subatsik, Staminas, Penelakut, Layaxan, Halalt, Malahat, the Métis Nation, and the Inuit peoples, along with the House of Friendship. Thank you. So today I'm just going to give you a quick update. I know I've only got a few minutes, so I'm going to run through these slides relatively swiftly, but if anyone has any questions, please feel free to ask them, and I'll try and answer them. I also have my colleagues here, Jennifer Jones from our Indigenous Relations team, the director for that, and Brent Johnson from BCRB. Greg Johnson, sorry. In terms of construction update, so this is a slide that everyone's seen previously, but just to give a refresher, the old hospital is on the left-hand side there. There's been quite a bit of community engagement on what's happening with the old hospital, and I just would like to reiterate to this committee that no decision has been made. We are not ready for that process yet. We are still working on our design, operational readiness, and construction, and I'll get into what that means further down the line, but we have not made any decision on that. We will have some community consultation in the not too distant future, but as of right now, nothing has been decided. In terms of the new hospital, it's 3 times larger. Our budget is 1.45 billion. If you say it quickly, it doesn't sound like much. It's fully electric. There are free parking stalls. There are 800 of them, twice as many as we currently have, and free Wi-Fi. The reason I reiterate both of those is that is number one and number two question we get every single time we go out into the community. We are trying to build this hospital as the most welcoming place of healing and hope, culturally safe for all, and that is one of our visions and our values that we hold at our core. So where are we? This journey has been a long one, and you have been along for the ride, many of you for a long period of time. We are currently in construction, and we have started our operational readiness planning. So our construction, we had a topping off ceremony earlier in the year. Several of you were there, including the past chair, Aaron Stone, and we all signed the beam. It got lifted into place for the diagnostic treatment building. And we've just started what we call operational readiness. It seems like a long runway, but it takes a long time to build a hospital, but it also takes a long time to get it ready for patients. So our first patient day is going to be in 2027, and we plan to have the construction complete late 2026. Sorry, 2026, yeah. This is where we are as of today. So we are at the corner of Balmackinnon there, or the southwest corner of Balmackinnon. This is our inpatient tower, the L-shaped building. And then the square building, can you see the cursor? You can. The square building there is the diagnostic treatment building. We have others. So this is our main community, what we call community hall with our mass timber entry. And then this is a reach out building with a Indigenous gathering space there. So that's where we're at today. This is our community hall, just to give you a sense. So this is double height space, mass timber. It bisects the two buildings. So on one side you have diagnostic treatment, which is essentially emergency, medical imaging, lab, pharmacy, ORs. And then on the other side you have inpatient tower, mental health, UBC, faculty med, and other support services. But as you can see, this is a beautiful space that will be a place for gathering, for community, and also it'll be a place that families and patients will be able to come down to and meet and engage. There'll be a cafeteria there and a coffee shop as well. This is the west entry, so this is the Balmackinnon main entry. It's looking out towards Swakos, there you can see on the left, or Mount Prevost. Once again, mass timber, curtain wall. It'll be a lovely entry to walk into as the new hospital. We are starting to put in our exterior finishes and our glazing. So this is some slate to represent Mother Earth, the rock around Mother Earth. So we've started to put that in, and you can see some windows are starting to go in as well. We're trying to make the building watertight before we have too much more liquid sunshine coming from the clouds up there. Internally, so we have large amounts of steel stud framing, and we're starting to put the mechanical and electrical systems in. Everyone seems to think that once you've built the exterior, it takes 5 minutes to do the interior and you can open up. It takes, unfortunately with a hospital, a long time to put all of those systems in. We're mapping it out to 25 millimeters, so everything above the ceiling is mapped and drawn in a 3D model before it gets built, down to the closest 25 millimeters, to give you a sense of how long it takes to install these things. And then on the left-hand side there is a typical inpatient room, and I think we've got a bit of a sequence to give you a sense as to what an inpatient room will look like in the end. From a clinical update perspective, just to refresh everyone's memory, hopefully everyone's seen this placeholder before, but I'm just going to touch on a few. In terms of beds, we do have 204, looking to probably operationalize 185 of those to start with, but we have increased our capacity for beds. We've increased our mental health capacity. We are going to have an MRI, single MRI to start with 2 CTs. We're going to transfer the existing CT, and then we're going to build a new CT in that space. Emergency is going to increase from 17 to 45 spaces with 3 different flows and approaches from a clinical standpoint. LDR is going to increase from 4 to 10. and I would ask if you have any questions on this, feel free to answer them. I will try and do my best. I'm not one of the clinical leads, so I know it enough to be dangerous. In terms of what we've been doing clinically, so the clinical team have completed design. We completed that around August. And we have segued into two different groups from clinical standpoint. One, looking at QA/QC through the construction of the hospital to make sure that what's being built meets our IPAC standards, infection prevention and control standards, and our needs. You can see on the right-hand side there, one of our team members meeting with the architect as they walk through, and there's iPads and phones and models that are accessible, so you can walk through and see a 3D render or a model of what's being built, so you can check to make sure it's built to the standard and the requirements that we have. And then on the left-hand side, you can see we're also looking at wayfinding and operational readiness. So wayfinding is one of those key elements that we leave till the end, because all of the design is done now, so things aren't going to move, and now we can start to focus on what the patient journey looks like and what wayfinding should look like to reflect that patient journey. In terms of operational readiness, so we have started, and on the right-hand side of the screen there is an artistic rendering of what a sim suite might look like. So we have the Faculty of Medicine as part of our overall program, and so we have a couple of sim suites. So this is just an artistic rendering. In terms of operational readiness, maybe I can just touch on a few things. So they're working on identifying the milestones for having first patient day. All of the simulations, all of the strategies, the patient journey, etc., has to be developed. What our new staffing model looks like, we're obviously transferring. We have about 1,000 staff thereabouts at the existing site. We'll have to transfer them across and train them to the new facility, because there's quite a few new systems going there. And then we have a hiring strategy for additional staff, and we're trying to we need to work out what our staffing model is to get accurate numbers, but in the round, there's going to be a 20 to 30% uplift of staff required. In terms of design, just to give you a sense from a clinical standpoint, we started out with the plans that are at the top right there. Then we built a full-scale mock-up in a Quonset hut we had on site. Some of you were able to tour that, so that's what you see in the image, is the full-scale mock-up of a patient room. And then this is what it looks like on site right now. They've started to put steel studs in for the wall framing, and the windows have gone in, and we'll replicate that another several hundred times. And then this is the final design. So this is what it will look like in the end. Those windows don't look large in this picture, but they are huge. They are some of the largest windows I've seen in a patient room. Access to natural light and view is one of those healing environment that provides better patient outcomes. And so we've baked that into the cake here to make sure that every single patient room has a great view of either SWACUS or the surrounding environment. Couch and health and care plan. So forgive me, I'm going to have to read my cheat sheet here, because this is not my wheelhouse, but the hospital is
Before you get into
the
the sheet, we're down to 8 seconds, looking for extension, moved and seconded. All in favor? Opposed, if any? Thank you. Carry on, sir.
Okay, sorry, my time management is poor, or maybe I've got too many slides, one or the other. So couch and health and care plan is a community-based, community-led approach to healthcare. So the hospital is one part of the healthcare system, but it's not the only part of the healthcare system. The community health and care plan is a sister project that supports the reduction of bed days, acute bed days, so that we can facilitate both at the existing hospital, but at the new hospital, care delivery where it's needed. And some of the activities that this health and care plan have rolled out are things like palliative services have been expanded in hospice. We have a new STEPS program, which is like a transitional program to get people back to back home through a model that takes them out of an acute bed into a step-down space and then out back to loved ones. The frailty assessment, we have advanced frailty assessment, and we also have a new hospital at home program. I am not the champion of this, as you can rightly tell, and I would recommend that if the Committee of the Whole were interested, we would have Donna or Joanne Tapp come and speak about the health and care plan in a more broad context, because it is really exciting and interesting stuff that we're doing here, and everyone's trying to replicate it throughout the island as well as in the mainland. They're trying to see what these special sources that Donna and her team have managed to bring to Cowichan, because we have saved bed days. It's around 20 a day or 19 a day we've saved, and the existing CDH has been under capacity, as in typically it was over 120%, 110% capacity, and with a health and care plan it's been down at that 100%, so where it should be. And so everyone is trying to understand how we've done it. And so I would recommend, if you were interested, to get Donna in to talk about that. She's got some great slides and stats. In terms of the next slide, so Indigenous relations, so we have an Indigenous relations team. We've recently expanded that to include some additional advisors, and they're adding weight to our program, our already existing program. We've been out to the community several times. This is Spinalcut, where we went out and spent some time with Chief and Council, and we're able to connect. So we're trying to engage with all nations, make this as culturally safe and welcoming as possible. And if there are any questions on that, Jennifer Jones is here to answer any of those. The last, I guess, what else have we got? In terms of art, so art was a key driver for us. We have launched our art program in September. We've had a couple of open houses now, trying to encourage artists to participate in the project. And just to give you some, for examples, these are a couple of projects within the Vancouver Lower Mainland area. So Children and Women's, on the left-hand side, you can see the art there, and then the Tech Acute Centre there is an OR, it's a paediatric OR, where there's art on the walls to provide better outcomes for patients. So we are looking to match or better what's been done elsewhere in the Cowichan Valley. In terms of BCIB, in terms of our employment stats, so one of the targets we have as a project is to encourage locals to participate in this project. So we have over 85% of our staff from start to where we are today are local, which is an incredible stat. If we were expecting a little less than that, and we've been really surprised that we've managed to support both the locals, but the locals have supported our project as well. In terms of apprenticeships, we're hovering around 20-25% apprentices, which is higher than other projects of this type in the province. And then our Indigenous specific employees for construction are hovering around 10-12% thereabouts, which is higher than any other project in the province, but we would still like it to be higher. So we are working with Jennifer and BCIB and the team to support all of those initiatives to bring both Indigenous, locals, etc. to the project. So we also have this, a bit of a plug, hopefully I can do this in the time. We have an info session for the community, December the 10th, 11 to 12. We haven't solidified the agenda, but it's likely to be more clinical focused, so people can understand the new services that are going to be at the new hospital. In addition to that, I'd like to thank our funding partners, being both the CVRHD, the foundation, so the Cowichan Hospital Foundation, and the ministry. And questions?
Thank you. I have Director Abbott. Morrison. Justice. Mackay. Why don't we just go around the room? I'm going to start with Director Abbott.
Thank you, Chair. Thank you, Mr. Davidson. Wonderful presentation. And as a person who has family members who have migrated through several Island Health facilities onto long-term care. This is very impressive when you see the mock-ups of those rooms. I did have a question about the future planning for facilities. When you're measuring out all that infrastructure down to 25 millimeters, how do you, 20 years from now, 50 years from now, adapt to new technology and retrofitting a building?
Great question. There are 2 to 3 answers to that. One being spare capacity. So we have about 25% spare capacity throughout. So the mechanical data, power, and then the mechanical air systems, etc. So electrical, mechanical. We have that spare capacity. We haven't built any shelved space in the facility. We don't have the budget to build space that can further expand, but we have adaptability. So we have what we call a future vision. It's a large campus site. We have the opportunity to mirror the inpatient tower. So if it's an L here, we can put an L over there and build another 200 beds, for example. We have an ability to, on the front of the hospital, here is ambulatory care. We have the ability to build another ambulatory care building up here and actually expand emergency and medical imaging into that space. So we have thought up to 2085 as a minimum for our design to get us. So we'd build parkades. This is the inpatient tower you can see there. We'd replicate it in here should we need to. So there are opportunities for us to expand.
Thank you. Director Morrison, next, please.
Thank you, Chair. Great presentation. This is pretty exciting because I've been here since we started saving for this project, so it's neat to see it becoming a reality. I want to first say that I think this is such a great example of community benefit agreements and the initiatives around hiring local and apprenticeships. This is, I'm hearing nothing but good news. I've got a friend of my daughter's is an apprentice electrician on site, and it's very exciting. I just want to, and I don't know if this is your wheelhouse or not, but we have a challenge coming up. I was at the beam raising ceremony and talking with a number of the folks that were there, and I think I remember the number 23% uptick in staffing in relation to what we've got now. I don't know if that's still the number, but when you say 1,000 currently, that's 200 and some odd folks that we need to add to the staffing levels here. So we both have a problem in that you've got to find the people to come and work there, and we've got to find some place for them to live. So has there been any sort of future casting into that first patient coming in and the staff up to ensure that we've got the people that we need to ensure that we can open up at the capacity levels that we want to open up at?
Another excellent question, and the answer to that is that's operational readiness focus right now. So we have an HR strategy. Until someone invents a 3D printer that can print nurses and physicians, we're stuck with what we have. So we have to both entice high school leavers to enter into education that is medical focus. So we've supported seats for nurses, for example. Island Health have. We've asked for additional seats for Cowichan. We have worked with the Faculty of Medicine over at UBC. There's a large resident program working with the local family physicians to support additional physicians and doctors in this space. But it is a challenge. It's not just a challenge in Cowichan, it's a challenge everywhere, right? We have St. Paul's coming online, we have Royal Columbian, we have our project. So it is something that we're all striving and working towards, but I have faith that our operational readiness team, they've been working for the last 3 or 4 months to develop what that plan looks like, what the staffing models look like, and I've been working with our HR team to try and build the capacity that we need.
And just as a follow-up, I'm hoping someone from that operational readiness team is talking with us because, obviously a a doctor is going to be looking at a different sort of residential housing option compared to someone that's a brand-new graduated nurse that's coming here. And we are sort of behind the eight ball on producing the number of residential units that are needed just on our normal growth patterns, let alone having a bump of a couple, 300 professionals that are coming to work and live in our valley. So I hope that someone will reach out and that we can work on our end to make sure that if you find the people, that there's somewhere where they can live.
Yeah, thank you for that, and we will reach out, absolutely. What is also, we've heard anecdotally, so there's no hard numbers, that there are a lot of people in the community that perhaps travel to Nanaimo or south of the Malahat that work in this field. And with a new hospital, they may decide to come and work in a new facility. So, there is part of that process as well.
Thank you for that. Director Justice, please.
Thank you, Mr. Chair, and thank you again for the presentation. I've got two questions related to staffing. The first one is a follow-up on Director Morrison's, I guess. If there are, I think you used the term of the number 230, but I got from you it would be like between 200 and 300 new positions at the hospital. I'm curious about how many of those would actually be specialist jobs like nurses and physicians and allied health professionals, and how many of them proportionately would be other sorts of staff. And I guess what I'm curious about is really how many of those 200 to 300 new jobs would actually have to be recruited from outside of the community, and how many of them would be new jobs available to people who are already residents here. Do you have any sense of that, just from maybe the proportion of?
Unfortunately, I can't answer that right now. We're not quite there yet. The operational readiness team have still to develop the approach. So unfortunately, I can't give you specifics. I can only talk in the round right now. We have a initial cut, but I'm not ready to socialize that yet within the within the context of this, because we need to do some more work.
Okay, fair enough. But if you don't mind, I mean, there must be a sort of a ratio, a known ratio at a hospital of how many doctors and nurses there are as a proportion of the
Yeah, there are, and
population?
I can circle back to the group with that. I will. I'll go back to my clinical team and ask if they can provide a general ratio. But as I said, I would rather socialize more certain information than have significant generalities out there in the community at this point in time. We need to focus on our work, and our work. It's going to take us a long time to operationally have this ready, and so we're in the infancy of that work now because we've just finished design, and as we develop that, we'll come back to this group with more certainty. But right now, it's too much in its infancy for me to socialize, because people. If I tell you a number now, that's the number you're going to remember from now until the end of time, and I want to make sure that I'm giving you the right number.
Thank you. May I ask a second question?
Your
Mr. Chair?
follow-up is now.
Thank you. So in terms of recruiting healthcare professionals, I believe that the availability of daycare is right up there with housing as an important factor in success. So I was wondering whether, as a part of this grand new hospital, there's any consideration of a daycare facility either within or nearby for recruitment purposes.
So daycare was not part of the original business case and was not funded initially. And we have designed, so our future proofing to the previous question, we have designed a space for a daycare, but it is not funded and it's not part of the overall budget to start with. We have been working with several developers, had some initial discussions with developers in and around the hospital. The hospital is, it can't function. It's the core of an organism, and it can't function in isolation with green fields around it. It needs gyms, it needs cafes, it needs supermarkets, it needs housing in and around it to support it, and that's why it's been located, better than I do, in the Balmakinnon local area plan. And so we've talked to developers about medical offices, pharmacies, and other things, daycares, with those developers very, we have to be apolitical, so we're not influencing developers, et cetera. That's not our role as a health organisation, but we have been in discussions to say, well, a daycare might work in and around the hospital for us, if they were interested in designing and building that, and the zoning was approved to support that work. We do have a team within Island Health that is looking at daycare support for our spaces. And so we've had several discussions with them as well, not just here, but also further up the island and south of the Malahat. So there are opportunities, but as per current design and business case, until we get the hospital back, we are unable to add a daycare to the hospital.
Thank you very much.
Thank you. Director Mackay?
Thank you. And it's just so exciting to watch the project evolve, and I really appreciate how you're continually bringing it back to the public, to have just insight into it and to actually be able to watch it. So it's great. You're doing good stuff. My question, though, being a pre-fretter by nature, is when it comes to the actual transition of patients and practitioners from one building to the next, has there been thought yet to what that's going to look like? Obviously, you don't turn off the lights in one building and turn the lights on in the next building and have everybody over there. So I'm just, and this is where it impacts our communities also, is the actual practicalities of a hospital. I need to go to the urgent care. Which one am I going to go to? Do you have any sense yet of how long that transition is going to actually take? We all know it's going to be messy. It has to be messy. But in that messiness is uneasiness for people. How long do you predict the transition is going to take to move all parts from one building to the next, so that this building's no longer our using hospital and this is fully our using hospital?
Unfortunately, feel like a little bit of a broken record. We're still working on that, whether it's a big bang approach or a graduated approach. I think the team was leaning towards a big bang as opposed to graduated. But we've got to engage our move management consultants and have them, we're going to have to transfer 150 patients across there. And how do we do that? So all of that work, that's the operational readiness work. There are going to be some lagging, some tail pieces of equipment. So for example, the CT that's up there already, I don't think we're planning on shutting that down 6 months before we've moved across. We're going to keep that up and running, and then when we transition across, we're going to decommission it and move it across, so that then we have our second CT, for example. Same with the mammography unit that the Foundation Fund raised a couple of years ago. That is going to transition across. So there are going to be a couple of elements that are going to tail the transition of patient and staff. But the team are working on it. We have a runway. It's not finished until 2026, and then we have 6 months to operationalize it. That's training all of the staff. So we're going to have to backfill. If you're a emergency physician or a nurse, you're going to be backfilled for a day or two or a week, so that you can go across to the new facility, learn all of those new systems, learn where everything is, and then come back. And then when we're ready for the big bang, you will know what the systems are, where the hospital where you are located in the hospital, where the pharmacy is, etc. So there's a whole raft of elements to this that need to be developed further, and that's what we're doing in operational readiness.
And a follow-up?
And I figured that would be the case, and I appreciate that it's already on the discussion tables. I guess I would just encourage everyone to not forget to make sure that the greater public is communicated to at that time as well, because terrible things can happen when a person doesn't know where to go when they need help. So as long as that communication is really stepped up on a sort of weekly or daily basis for people who need to know, it'd be great. Thank you.
Yeah, that's great. And if I can just answer that, we have a superb communications team, in my humble opinion. They're developing these slides. They get me in the right position to speak every 3 to 6 months, and they're looking at that change management piece and communicating with the community. So that will be fulsome. We'll put ads in, the citizen. We will have community events ongoing throughout that transitional process. It won't be a surprise to anybody. You'll be sick of hearing of us.
I doubt that, but thank you for that. I have Director Douglas, Director Wilson, Director Callio, and Director McClinton next.
Mr. Chair, I have two questions. So the first is with regards the percentage of local workers. I think, Mr. Davidson, you mentioned, was it 85% of them?
Thereabouts, yeah.
Local.
That's cumulative, yes.
Cumulative. Could you explain to the board how you're defining
Local?
local worker?
Oh, absolutely, yeah. So it's, local is defined as 100 road kilometres. So if you live in Delta and you catch a ferry, you don't count. So it's essentially Victoria through to just a little past Nanaimo is essentially the 100 road kilometres is counted as a local.
The other question was with regards to the mental health and substance abuse use facilities and services. I know as you've explained in your slides, there's going to be an expansion compared to what's currently offered at the CDH. Could you elaborate on that, how that services are going to
Yeah,
change?
so we have three opportunities in the facility. So we have what's called a PAIRS, essentially it's Emergency Psychiatric Assessment Zone, and that is in the emergency department. It has a small outdoor space that goes with it, so that if you need to, calm yourself or be supported in an outdoor space, you have that opportunity. We have increased mental health beds, so we went back to the province and asked for an increase in our bed numbers. We had 17, we've gone up to 20. So that is on the ground floor of the inpatient unit, and it has large access to open space, secure courtyard, so that you have access to that. And then there's a just here as a youth mental health space as well, with access to outdoor space. So there are three clinical spaces.
Thank you very much. Director Wilson online, please.
Thank you, Chair. Thank you very much for that presentation. It's extremely good. A lot of my questions have been answered, and that goes back to staffing as well. And one of the things that I've heard speaking with medical staff is that affordability, of course, comes into it. Where am I going to stay? And that's something which I hope that we at this board will be addressing, so that there is space for the 200 or 300 people that we need more all the time. You did mention daycare there, and this is something which to me is quite important as well, because unless people have that facility, and one of the things that I found working overseas, that a lot of the big companies in places that I was running training courses was that they had those facilities on site, and I'm glad to hear that you might be looking into something like that. As far as operational readiness is concerned, building it is the easy part, as you say. It's getting it ready, and we had the same problem with building ships and systems training, etc. I did have a question about staffing. That's already been answered, but it's something which I really do feel is one of the most important parts. So I'm not asking a question here, but Chair, sorry, I did have them, but they've already been answered. So thank you very much for everything you're doing there.
Me or the presenter? No, thank you, Director Wilson.
Could I just add just to that, like, if the committee of the whole would like, perhaps in 6 months' time, we could come back with our clinical operations team, Janine Kidd, maybe Alice Gelbke, and they could give you a little bit of a synopsis as to where we're at, what the timeline looks like, what they're looking at, what they're focusing on, if that's something that this committee would be interested in.
You're always more than welcome to join us with updates as they happen, I'm sure. Moving on to Director Callio.
Thank you, Chair. I'd just like to say that, this is one of the best things to happen in our valley in a long time. I remember the old hospital when we first came to town in '66, and it was brand new then, so shows you how long I've been here. Looking at the hospital right now and the picture that you have here of a drone view, it's, having that little park area in the back, I realize that's so important because, having had people stay in the hospital in extended periods of time, it's just so amazing to be able to take them out in a wheelchair into that area and walk them around. It's super important. And I do have a question for you, and that is, I know you said nothing has been decided for the old hospital, but do you have any ideas?
Not at this time, no.
Not going to commit to anything?
Well, literally, it's not part of, all cards on the table. It's not part of this business case. It's not part of really my area within Island Health, but I'm taking the lead on this because there's such community interest. But nothing has been discussed at Island Health. From the CEO down, no one has got their eyes on it, their fingers on it, their thoughts, anything, because we are too concentrated on this. This is taking a lot. I can't stress how much energy is going into this. There's a lot from our side going into, the design. The team were working, extended hours for 3 years trying to figure this out, and now they're working on operational readiness, doing exactly the same thing. There is so much energy and effort that goes on here that we don't have time to take our eye off the ball and look at the existing. We have an existing site team that are keeping that hospital running, but no one, and I can attest to this wholeheartedly, no one has got any plans for the existing CDH at this time.
Okay, thank you.
Thank you. Looking around, I will insert myself here.
Chair?
I'm sorry, I didn't see your hand there. Director Martman, you go first, please.
Sorry, I didn't want to preempt you by going last. Thank you, Chair, and thank you for the presentation. I don't know if I missed it, but I'm interested in the aspect of the training, being a training hospital. Is that part of the mandate for this build out? And also, what parts of the hospital would be dedicated to that? Some insights from my past is, sometimes this gets missed. Library facilities, digital facilities, auditoriums, all those have been built into other hospitals. Do you see any of that happening here? Thank you.
Thanks for the question. Yes, we have. So we have, I'm just going to try and find a slide that illustrates it. There we go, that'll do. So we have the Faculty of Medicine on site. They take half of this building here. So this half here, essentially at the lower level, is Faculty of Medicine. So that's residents, physicians, etc. We are Island Health, inherently a bit of a training facility anyway. We're trying to encourage our staff to develop. I mean, succession planning is huge. You can't 3D print anybody, so you need to enable people to grow and develop. So we instill within our staff a mentality of training. But in terms of your specific question, yes, this Faculty of Med have space here. We have meeting rooms, education spaces, and you can't see it here, but essentially a conference facility that will be, which will double as a training facility when needed.
And a follow-up, if I may?
Yes, sir.
That's great to hear. Just also, how about the School of Nursing and those branches as well?
Yeah, so nursing training will be done in those education spaces that are on the back side of this building. We have some spaces there, and then on each floor there are also meeting spaces that could house or host training activities.
Thank you, and Chair, I would look forward to something back in 6 months on the staffing part. That'd be great.
My colleague Jennifer Jones has got something to add.
I just want to acknowledge that this year, the Duncan Physicians, we have a residency program that just started. So we have 4 residents that are in their third year of becoming a physician. And all of those residents are committed to staying and working in the new hospital. Next year, next June, I believe, we'll have 8 residents. So we're working on that, and then just acknowledging we always have nursing students at the current hospital, which will follow through from Victoria, from UVic University of Victoria, and I'm going to say Malaspina. I can't remember what their new name is. Anyway, VIU. Thank you.
Thank you for that.
And maybe I can just add to that. If anyone has any loved ones that are interested in a career in hospital healthcare, please send them our way. New CDH at islandhealth.ca.
Is there an age
And Chair-
limit? I have a PTA.
And Chair, just so they know, my daughter's in second year nursing at VIU, so it's not else, it's meant VIU now, and so she's definitely looking at CDH, the new CDH. So one that doesn't need a house.
There we are. We're doing recruiting as we speak. Excellent. So, Director Abbott, you have a follow-up?
Just trying to learn more about the virtual info session on December 10th. I've looked on your website. How do we?
We're gonna update the website shortly. We're just trying to establish an agenda, and we're gonna post in the Citizen, I believe. So Audrey and Anna are just working on an agenda and a slide deck, but it will be coming in the not too distant future, probably before December.
And I will ask mine now. I'm looking at your supporting cast. I'm wondering if there's a doctor in the house?
I didn't bring a doctor with me.
I'm 2 months post-op from hip replacement surgery, and I just wanted to gauge how I'm doing. No, but seriously, I wanted to give a big shout out to the staff at the current CDH for the care that I did receive there. I did not stay that extra day, so I saved you a bed day.
Thank you.
On the premise that my surgeon said that there's sick people in this hospital, you don't want to stay overnight. But to everyone there, and that was my microphone. It happens quite regularly if you go back and watch videos previously. But I wanted to shout out to all the staff currently within that aged facility on the care that I received on my hip replacement. I appreciate it. Thank you very much.
Thank you.
And with that, I will thank you for the presentation and to all your supporting staff for coming and joining us this morning. Thank you very much.
Great, thank you.
And don't feel obligated to stay and watch.
Okay, we'll take off. Thank you.
Okay, we'll just take a short pause as the gallery clears. And we shall resume. Ms. Boyd, please.
Thank you, Chair. We have no correspondence or information items. We'll move to reports. R1, report from the Recycling and Waste Division, Management Division, Recycle BC agreements.
Good morning.
Good morning, Chair.
Push the microphone button, please. There
Thank
we
you.
are.
Good morning. I think I forget that every time. All right, so the CVRD has partnered with Recycle BC for residential recycling management since 2014, and we've operated under the same master services agreement since then with various amendments to the statements of work which make up the agreement. In June 2024, staff were notified by Recycle BC that they would be proceeding with developing a new agreement. This new agreement includes changes to fines and acceptable contamination rates, as well as changes to incentive rates and the methods for calculating them. Because collectors like us have noted that agreements with Recycle BC generally favor Recycle BC, we believe that a legal review of the agreement is needed to help us identify risks, as well as get an opinion on how best to proceed. We'd like to explore a joint legal review with other jurisdictions, as there's potential that a united front may benefit the negotiation. So Recycle BC has given collectors two options. We can sign the new agreement as written to agree to the new terms, which would be effective December 31st, or the option which we're recommending, which is to sign the agreement which will give us until, sign the amending agreement, which will give us until May 1st to review and propose changes to the agreement. There's no financial risk to signing the amendment, as the new proposed rates will be effective January 1st, regardless of which option is signed.
Thank you. Looking around the room. Director Abbott.
I read this earlier this week, but I think I noticed that GFL bailed out. So part of the review, will it address our contract strength so that by May we'll have a stronger contract to protect us from a last-minute change?
Through the chair, I hope that with opinion that we received from the lawyer and feedback that we received from legal review, that we may be able to strengthen that. That's the hope.
Director Douglas moves the recommendation on the amendment. The amending agreement and seconded. Any further discussion? Call the question. All in favor? Opposed, if any? That motion carries. Thank you.
Thank you.
Ms. Boyd.
Thank you, Chair. R2, report from the Arts and Cultural Division regarding the Arts and Cultural Master Plan.
Good morning, Mr. Alzinga. How are you today?
Very excited, Mr. Chair. This is an exciting day for the Community Services Department in bringing this report forward, and so we're very pleased to present today. I have some arts and culture people here that I would like to introduce. So Patrick LeBlanc, you're a manager of arts and culture. Laura Stevenson, one of our key arts and culture team members, instrumental, and we have Leah Carlberg from Happy Cities, who is going to do a PowerPoint presentation for you. So very excited to be here. I'm going to turn it over to Patrick for any additional introductions, and then we'll get the presentation going. And maybe Rebecca can help us on that one. Thanks.
Thank you and good morning. It's really very exciting to be here. It has been, we started this process a year, and the overall process has been going on for several years, gathering the money to be able to do this for the Arts and Culture Division. Easy to read. Last year around this time, we went through the RFP process and we hired Happy Cities to, they were the less corporate, more creative, fun idea. And so we went with them and we've gotten a really wonderful plan. I hope you've been able to read it. And without any further ado, I'd like to introduce Leah Carlberg from Happy Cities to do the presentation.
We'll just get that up for you so we can follow along online and on the monitors in the room. You're seeing that online, are you?
Hi, everyone. Thank you so much for having us today. My name is Leah Carlberg, and I work as an urban planner with Happy Cities. I'm joined by the Arts and Culture Division, and we're very excited to be presenting Creative Cowichan, which is the CVRD's first ever Arts and Culture Master Plan.
Hi, there's just a blank screen.
Sorry, I'm just trying to move it. Okay. Thank you so much. I'm a millennial. I should be I'm good at this. But we just have 10 minutes today, so I'll try to keep it brief. I'll share a bit about the process of developing the master plan and then the outcomes. I do hope that you've been able to take a look at it being circulated in advance, because 10 minutes is just simply not enough to dive into everything I would hope to share. As I mentioned, my name is Leah. I was joined by my team at Happy Cities based in Vancouver and on Vancouver Island to support with the development of this master plan, as well as Melanie Watson, a local community member and artist here in Cowichan, who supported as a local liaison, and the Mastel Group, who helped us with a representative phone survey to hear priorities from the community early on in the project. Happy Cities is an urban planning and design engagement firm. We work on planning, design, engagement, and research all across BC, and we're really excited to be working with the Cowichan Regional District on this project. First, I'll zoom out. I just wanted to set the stage, if you'll excuse the pun, to share a little bit about why arts and culture is so important. And it was really wonderful to see how arts and culture was also incorporated into the hospital presentation that just happened earlier this morning as such an important part of our well-being and connection on a day-to-day basis and across the region. So not only does arts and culture contribute to the regional economy and to innovation locally, it supports reconciliation through interpersonal connections and through intergovernmental opportunities as well. It also provides sort of these intangible moments that bring meaning and connection to our day-to-day lives. Sorry. I wanted to share as well that in 2021, the arts and culture sector in BC was estimated to be $8.6 billion, which is larger than the forestry sector and also larger than the hotel sector. So recognizing some of those important economic impacts. I'll zoom a little bit into the regional context of the master plan before it was developed. So the Arts and Culture Division at the CVRD is fairly new. It was established in 2016 with the Service Function 400 and was given a $130,000 budget to distributing grants towards arts and culture across the community, and also to operate the division with 2 staff. It's worth noting that since 2016, this operational budget hasn't increased for the Arts and Culture Division, which is part of why we're here today. Then in 2019, the Regional Recreation Strategic Plan provided direction for the CVRD to develop an arts and culture strategy. Last year, the CVRD board provided direction for staff to develop this, and earlier this year, Happy Cities was hired to work with the division to create a plan that really reflects the priorities of a growing and diverse region. The master plan aligns with a number of the CVRD's existing strategies, including the new strategic plan and the official community plan for electoral areas, as well as a number of other goals listed here. For example, in the official community plan for the electoral areas, there's a whole section on arts and culture, which each of these strategies are also reflected in the action plan and the outcomes that we're providing as really practical ways for the CVRD to be accomplishing these lofty goals. Then I'll zoom in a little bit more to the Arts and Culture Division itself. Within the $130,000 yearly budget, $30,000 is distributed in annual grants each year to arts and culture organizations, largely nonprofits. $50,000 is distributed to the 5 sub-regional arts councils. And the Arts and Culture Division is operated by these 2 staff members who work 1.5 days a week collectively. I would just know that you would never guess that they work such limited hours based on the incredible dedication they show to this work and the presence that they have in the community. People were so surprised to hear that this is really what the division is working with. And as part of the work we wanted to do this year was to identify the gaps and needs between how the division is currently operating and where we would like to see it go to really be able to respond to community needs around arts and culture. I'll circle back to what those needs were. So the Arts and Culture Master Plan launched earlier this year. It was guided, as I mentioned, by the CVRD's existing strategies. It was also guided by research on best practices in arts and culture planning at a regional level. And it was informed by 2 rounds of community engagement where we were able to hear from a number of community members and key voices that represent community organizations from across the region. Through this engagement, we aim to hear about the community's aspirations and priorities, and also aim to hear about how the CVRD can best fill these needs. We spoke with arts councils, arts guilds, musicians, theater groups, educators, students, representatives from local government and the First Nations, and the tourism industry as well. We spoke with community members from really across the region, from Lake Cowichan to Ladysmith, from Chemainus to Cowichan Bay, and everywhere in between. In total, 1,500 people shared their priorities with us to help shape the master plan, way more than we were expecting, about 1% of the whole region's population. And through this engagement, we heard that people really wanted to see the CVRD being able to provide and support spaces and facilities for these important activities to happen, that the CVRD should also be organizing and supporting arts and culture programming, so events, activities, festivals, much like they have been able to do over the last few years, offering really practical resources for community groups and individuals to be able to achieve their goals, and also to play a role in promoting events and activities across the region, for example, through an online calendar. It became clear very quickly that the CVRD plays a unique role in the region and is able to convene and share information in a unique way at this regional level, whereas some of the smaller organizations might not be able to know what's happening at that scale. Other top priorities from the community included more live performances, public art and festivals, and reducing barriers to accessing arts and culture, whether that's around the cost or around knowing what's going on in the community, I think those are the 2 big ones that I will mention. And of course, the priorities that we heard through community engagement are really reflected in the actions that came out of this plan, where we're really trying to address those needs and understand how the CVRD, even with limited resources, can best support them. So the master plan presents 6 creative strategies. There's a strategy on information and resources, on programming, so events and activities, on spaces and facilities, on partnerships and collaboration, on funding opportunities, and on public art. Each of these creative strategies is detailed with actions on how it can best be accomplished. So the first strategy on information and resources, for example, has the first action to improve community-wide access to information about arts and culture offerings. So for example, a sub-action here will be to develop resources to host an improved webpage, including, for example, an inventory of the arts and culture organizations that are operating in the region, what they're doing, how to contact them, and then information on spaces and facilities, what's available if you'd like to book something, and what you might need to know about, for example, applying to book that space, applying for insurance, and so on. We have a number of actions on programming, including to work with community-serving organizations to provide regional coordination and marketing support. So a sub-action here, for example, is for the Arts and Culture Division to be collaborating with Tourism Cowichan to be really elevating arts and culture as a key draw to the region for tourists. Strategy 3 on spaces and facilities. The first action is to increase access to spaces for arts and culture organizations. So again, providing practical resources for people to know what spaces are available for arts and culture use, at what costs, and information on booking them and so on. As a key part of the strategy, we also want to review and monitor access to CVRD facilities for arts and culture uses, including outdoor parks, so the CVRD can have a better sense of which spaces are being used and how, and to understand future gaps in the next 5+ years and how they might be able to be addressed as the community continues to grow. The fourth strategy here is on partnerships and collaborations. I won't read them all, but importantly, actions here include to work with jurisdictions, electoral areas, and the First Nations to align our arts and culture goals, to be able to share resources where possible, and to continue to build these really important relationships. The fifth strategy is on providing funding opportunities and accessing funding opportunities. As I mentioned, a key part of the division's role is to distribute funding through arts and culture grants across the region. Then the sixth strategy is on public art, and here we have 2 actions to identify and encourage new opportunities for public art, and also to improve the resources and policies related to public art. Again, each of these are accompanied by a number of sub-actions that I simply don't have time to read all of them today. Most importantly, we wanted to talk about implementation. The Creative Cowichan Master Plan provides strategic direction on arts and culture for the division for the next 5 years, and a number of actions have been identified for priority implementation over the next 1 to 2 years. These are actions that might have lower costs or be a higher priority from what we heard from the community. We anticipate that after 5 years, the master plan will be reviewed and updated, and it will be important for it to continue to meet evolving community needs, but also to continue to meet the evolving capacity of the Arts and Culture Division as it becomes more and more established. Now, the success of this plan really requires an ongoing commitment to arts and culture and to the division, especially over the next year, and then on an ongoing basis over the next 5 years. And this includes a modest increase to funding and staff time to support some of these goals. So as I mentioned, we had set about to identify what some of the gaps are and the needs of the Arts and Culture Division. Last year, there were $30,000 distributed in grants, but $90,000 requested, and 19 groups had applied for funding. 10 of them were able to receive it. So as you can see, there's a bit of a discrepancy in sort of what the community is hoping to accomplish. Some of these really impressive initiatives that are taking place with fairly limited amounts of funds. Similarly, there's a bit of a gap in what's being distributed to the arts councils and to the amount of funding that's sort of requested or that they would like to be working with. As I mentioned at the beginning, this amount of funding hasn't changed since the function was established in 2016. And then lastly, a small increase in staff time, which I'll expand on in a moment. For context, the bylaw that establishes the Arts and Culture Division budget states the maximum amount of money that can be requisitioned for this work. But because the budget hasn't been increased since 2016, the current day value for the requisition would be $342,000. That's $200,000 more than the current budget's providing. A detailed budget request is expected to come with the 2026 budget to help implement Creative Cowichan. However, in the meantime, in thinking about how we can move forward to action some of these items in 2025, staff are recommending a minimum 5% increase for 2025, and this can be accomplished by transferring 3.5 administrative hours per week from function 426 to function 400. So no new money is necessary for this small move. These modest requests will help set the CVRD up for success in adopting and implementing its first ever Regional Arts and Culture Master Plan. However, it's worth noting that any additional funding or staff hours that could be secured in the short term would be hugely beneficial for the master plan as it moves forward. Before I open it up for discussion, I think we have some time for Q&A. I just wanted to share a really heartfelt thank you to the committee for the support to arts and culture since the function was first established in 2016. So thank you so much.
Thank you very much for the presentation. Looking around the room, I see Director Abbott. Let me get my list going. Director Deck, Director Douglas, Director Justice. Start with you, Director Abbott.
Thank you, Chair, and thank you for this fulsome report. I was intrigued by one of the quotations from a participant who said, "We need to see arts and culture as important to our communities as sport and wine." I thought most appropriate, maybe cheese. Missing in the short-term priorities, I may have overlooked it, but I think there's an opportunity for more partnerships with youth and our educational systems. And if I may, a secondary question would be, I think I read that the CR, the Capital Regional District, offers tax deductions for donations. This would probably be more for finance, but how can we get on that same track to be able to offer tax receipts? Thank you.
My understanding is that theoretically we could, but I know it's a bit of a process, so we would have to have discussions with finance to see how that could happen. We're actually, the youth is in here, it's quite a bit, and we are already establishing, actually, we've already got a youth advisory committee for the theater is one of those things that we're doing, and really working at how we can get youth more involved. Like the idea of, the legal graffiti wall, because we know if there's a legal wall where people can, those young people can work with that, they're not going to be tagging, giving them activities, and that's a really big part in this, but the capacity for hours to be able to implement the projects is where our biggest challenge is right now.
Thank you. Director Deck, please.
Thank you. I attended the meeting or the engagement and meeting at in Yubo, and I was just so thrilled with the joy and the enthusiasm that you brought, and the opportunity for the group that's Couch and Lake Arts and Culture folks to have their input. And I think, I could see the alignment in what you were talking about and what they hoped. So I'm very glad to see that. It was contagious, and so I wish you all the best.
Thank you.
Thank you, Director Deck. Director Douglas, please.
Mr. Chair, I just want to thank CVRD staff and Happy Cities team for all your work and bringing this strategy forward to the Committee of the Whole and hopefully to the board later today, and to do so in a way that involved the arts community and the general public. As you noted, there was over 1,500 people participated in this, which I think indicates there's pretty strong buy-in for moving in this direction. I did have one question, though. We have heard recently from the Couch and Public Art Gallery group, also the Couch and Musical Society as well, are looking at building new facilities to support the arts. My reading of the plan you've presented would allow us to kind of fit those concepts into our priorities, depending on how fast they move forward. Just want to confirm that with you, that the plan as presented could incorporate working again with those groups if they are able to build some more momentum with their proposals.
I can speak to that. Absolutely. I think a key part of the work that we did was helping to define the CVRD's role in supporting some of these initiatives that are led by the community that are meeting really important community needs. So of course there's the public art gallery. There's also ongoing work to understand if there's demand for another mid-sized theater, as Mercury Theater has closed its doors in the past few years. As I mentioned, we're working with sort of a fairly limited budget in terms of what we can actually offer financially to organizations across the region. So what we're trying to do as much as possible is offer practical resources to these organizations, including the Public Art Gallery, as well as opportunities to connect with other organizations and to sort of facilitate or convene some of these conversations where we might be able to multi-solve, whether it's around accessing spaces or developing new spaces and partnerships where the CVRD might be able to provide a role in bringing some of these groups together to work on accomplishing what they're hoping to do. And another sort of role or potential role for the CVRD, which is detailed through some of the actions in the master plan, is to provide practical support, whether that looks like a recommendation letter or providing opportunities to external sources of funding as well where they're identified.
I would add that there was definitely a lot of interest in the idea of additional facilities, and we know that's a big ask. But, you know, something like a regional needs assessment for facilities could be really helpful, and I know there has been some discussion about that. Even, you know, as far as spaces, storage spaces for arts groups and other additional performance spaces and galleries, there definitely was a lot of interest from the community in that access.
Thank you for that. Director Justice, that was my microphone.
I won't take it personally, Chair. I've got a question about, there was one strategy, I think it's 1.2E, which is about host ongoing grant writing workshops for arts and culture funding, which really intrigued me, but I didn't see it sort of further developed. It was just sort of a one-off mention, and it seems to me that this is perhaps a pretty good strategy compared to increasing the arts and culture grant stream, especially in the long term. I mean, helping people learn how to access external funds obviously has some long-term and great short-term benefits for the CVRD with our budget woes. And I wonder whether you could just comment on that generally, the idea of helping arts organizations better access grants, and why that's sort of more emphasized in the plan.
One of the things that we found through the granting process, through the adjudications, was that some of these groups are not successful getting gaming grants or BC Arts Council grants. So we actually started last year on our 1.5 day a week to start hosting those granting sessions. So we have hosted sessions on how to fill out the CVRD grant that we have, which is not a lot, but it's helpful. And we connected with gaming to have gaming people come in and do a presentation and answer questions so that they, you know, so that groups would be able to do that. We did another one of those this year where we connected everybody to gaming. I've been in discussion with the BC Arts Council and Canada Council to see if we can get representatives here, because like you said, the more that we can help them get their, you know, gain more money and the more that they can do for our community. I don't think it'll ever negate our role, but anyway, we can certainly help them. And I think one of the big things we can do is that communicating and that connecting and helping them connect with each other. We had a session yesterday with all of the arts councils talking about this, and that connection between them and how they can, you know, talk to Arts BC about possibly hiring together a grant writer to help them all do their grants. So any of those sort of ways that we can facilitate is ways that we're looking at helping them out.
Okay, great, thanks.
Thank you for that. Director Wilson next, please.
Thank you, Chair. And thank you very much for the presentation here. I think Director Justice picked up on one of the things that I was going to mention anyway. He used the term budget woes, which to me is quite descriptive, actually. And throughout the report, I'm seeing the words public. I'm seeing limited resources, practical resources, and all the rest of it. Now, don't get me wrong here. I will support the arts as long as they are truly public, which is what you've touched on here a lot. I'm not sure that I could support anyone who puts the word public in their title. It's kind of semi-public, it's not. But from the point of view of supporting what you're going forward here is concerned, this is great. So I would ask if you are going to be concentrating on those which are truly public, such as the Cowichan Valley Arts Council, which does a great job, as opposed to others who put the word public into their titles.
That's not a loaded question. Who wants to take that?
Sure. Thank you, Director Wilson. Interesting question. Our priority is definitely the overall public of, the arts councils that are public, like you said, and all the activities that are public. This is definitely where we are responding more, shall we say. There is the possibility, though, of requests for, like a mid-sized theater, art center, art gallery. Those requests are out there. And I believe they should be looked at, but it's definitely our focus is on helping our arts councils and our arts organizations and our local artists more than other areas.
Good. And a follow-up, please, Mr. Chair.
Okay.
Promise not to load the question this time, but there was mention of others coming forward. Agreed. Funding streams such as one-off grants and things like that, treated on their merits. That's a great idea. But like I say, I will concentrate more on the public, as you've outlined here as well. Thank you very much.
Thank you. I do see some directors online. I have Director Morrison, Acton, McClinton, and Nicholson. So Director Morrison, please.
Thank you, Chair. Thank you. Great report. It's interesting when we get elected in these roles, we often don't know about the things that we don't know, and arts and culture was one of those that I've had to do a great deal of learning and think of myself as a bit of a convert now. I found this quite fascinating, and I'm going to preface my comments by the notion that we have incredible talent all throughout this region that often we don't even know about. And I just think of my community where, I've got very well-known artists, and yet nobody knows who their neighbor is and some of the successes that they've had during their working life and their careers. And so I'm very excited and was supportive of the grants to the local councils and the work that's being done. And I view that as a bit of a decentralization of the funding that we provide. I know it's not a lot, but it's helpful to those organizations. Where I'm going with this is that I think there was a number of groups that were anticipating this report coming in. And we've already heard some mention of it, but I'm looking at, like, for instance, Strategy 3. Where are we, what are our facilities and what do we have access to now that would be able to help and support our organizations? And I think of our community halls and our recreation facilities that can, they've got the security, but they don't have storage, right? And I know storage is a big deal. So I'm just wondering if you have a sense, and I would be supportive of the move to add more hours to our staff's work, because I think this is one of these investments that we make on behalf of our residents and taxpayers, where there is a huge return. For every tax dollar that goes in, I think there's a huge return. I view, like, our budget stuff is pretty dry and black and white. It's arts and culture that provide the color to the image, and I think that's really important. So would we, on the basis of this report, do you see a better result and a better support for adding to the more decentralized approach, the local arts councils, the art in the communities, or would you see a more centralized approach for larger buildings, larger facilities, larger single-purpose dedicated type of venues. And that's really going to, are we looking at an art gallery, or are we looking at capitalizing on the skills and talents that we already have in our communities and nurturing and supporting that? That's where I'm going with that question.
Thank you so much for the question there. So through our work too, as I mentioned, we were largely guided by what we heard from the community and posing a lot of these questions to the community. So some of the questions we posed were around what facilities do you use to access arts and culture currently, and what are the gaps there? And through the facilities that people often use, a lot of them are CVRD facilities or facilities from the local jurisdictions. And we also heard, so we heard a number of priorities about actually that these facilities are working. Like you said, there's no loss of talent and activity in the region. It's really about can we amplify what's happening? Can we connect people to what's happening? So providing greater access to these existing facilities was definitely something that we heard about as a top priority. So for example, when they're available, what's available, when it's available, how do you access it? If you need to apply for insurance for something like a festival, can the CVRD play a supportive role in that? Through asking the community, we also heard that actually outdoor spaces were one of the #1 places where people go to enjoy and interact with arts and culture. So again, these are spaces that, to the previous question, are publicly available. They're spaces that can be accessed and activated, and we can plug into sort of amplifying what's already happening, letting people know where it's happening, drawing in talent, and the CVRD can play a really wonderful role in convening that with fairly limited resources. And then in terms of new facilities, I can mention the top sort of facilities that came up through engagement. There were a number, and we did note them in the master plan as sort of maybe in 5+ years when the CVRD might be able to support more and more in some of these ways. So these new facilities or facilities where people mentioned them included a cinema, the new public art gallery, also smaller gallery spaces to showcase local art across the region, and then the mid-sized performance venue, which we had mentioned, as well as a maker space and workshop spaces for more hands-on art activities. So there are a number of these facilities that are definitely on our radar where even if the CVRD isn't able to develop that facility immediately, can we help the public access private facilities or work together to access the funding needed to fill in these gaps?
Want to follow up, Director Morrison?
Yeah, just a quick note, and I relate, though it's not, well, it's an activity. When the local fire department puts on the Easter egg hunt in Honeymoon Bay, it's fantastic to know that and it rains around here, that if we have inclement weather, they can naturally go into the community hall if it's available. But I think coordination of an outdoor space with an indoor space that's adjacent would be a huge thing. And that's one of those simple tasks that I think that if we could coordinate and make sure those were available, I think that's an important thing that we should be doing as well. So thank you for that.
Thank you for that. Online, moving to Director Acton, please.
Thank you, Chair. Thank you for the report. I think it's really important to have this strong document. And I think it's like the things that to me showcase maybe not so much adding more funding, but working better with Tourism Cowichan, economic development, help support their direction. But I have a couple of questions. One question being, out of these 1,500 people, how many were not part of an arts group or just an average person, and how many were willing to spend more tax dollars to support it? And then I guess I can just start with that question for now.
There's generally very strong support for increasing the CVRD's ability to support arts and culture. A majority of people either strongly agreed or agreed that the CVRD should be doing more to support arts and culture. In terms of who is involved in different capacities, it's difficult to know because how you self-identify as an artist or enjoyer of art is very broad. And I think across Cowichan, we have such an extraordinary number of people who are involved in the arts, whether that's sort of through appreciation or enjoyment, or whether as a professional artist or somewhere in between. So for that, we don't have an exact number, but it was a pretty representative number of people, especially when we were able to speak with community members at spaces like the Farmers Market, at various events across the region.
So I guess my question of,
Can I just add
won't.
to that?
We have
Sure.
addition.
Sure. I just wanted to add too that the pop-ups that we did were at hockey games, they were at the public market, they were at the Cobble Hill Wooden Boat Festival, they were at Indigenous Days, they were at Lake Country Days, they were at, Music in the Park in Cobble Hill. We went all over, and we didn't go to necessarily arts events. We went to public events, and that's where we asked people questions.
That's really great. I just always struggle because people want things, but then they don't want to pay for it. And in times of, even in the past, even the dark ages, right? When there was no money, arts and culture is where it's not spent. But go ahead, sorry, I'll ask my second question. The speaker wanted to say something else.
Sure. I will also just add that the representative phone survey was part of our engagement early on in the project. We were able to connect with 200 people through the representative phone survey. Again, of course, representative of sort of age, demographic, background, gender, and so on across the region. And through the representative phone survey, we also heard agreement and strong agreement for more support towards arts and culture. Thank you.
And now your second
Thank you.
one?
And one, well, I'm really glad that you mentioned the part about parks, because as an area director, that I've heard that so many times over and over again, and it's actually unfortunate that it's taken us this long, it hasn't even happened yet, to change our bylaws in our parks to allow for events to happen easier and for spending to happen and food trucks and et cetera. So I hope that this report can actually make that one of our first changes that we make, and that would have very little funding impact. I guess the other thing that was interesting that you mentioned, funding for the area director to help support. So that my heart grew a little bit there, because area directors in the past have never really been included on any kind of community engagement like that. So I think that's pretty neat. And then maybe we can even start to have area directors have a seat at the arts councils or something, like just more involvement like that as a commission. Because I know I've actually tried to join my arts council on their board, but then it became, we were worried that maybe that wasn't kosher. But anyway, so that was good to see that on there. So maybe we can change some of that in the future. Thank you.
Thank you for that. Director McClinton, please.
Thank you, Chair. Thank you for the presentation. I want to commend you as well on sort of your budget suggestions and not specifically asking for any new funds in this go around. I'm just thinking ahead to 2026 and the anticipation of asking for increase. It's going to be a little bit more of a challenging question, but what do you say to, I'm thinking of the communities like Yellow Point, Cedar, Saltaire, Thetis Island, who in all likelihood in 2026 will have seen their taxes double in this elected term, their property taxes, and that's not including all their other taxes. What do you say to those folks who, and most of that increase has gone to regional services, so not a noticeable change in their community in any specific, how do you make the case to those folks that this sort of work is important? And I think, intuitively, I know that this is important stuff and it makes, everybody feel good, it adds to our life. But, when facing sort of those financial challenges, what do you say to those folks?
I think it's it's kind of a multi-part answer. I think those people in those situations probably appreciate art a lot more than the rest of us, especially if they're somewhat isolated or they, it's becoming more of their life. And I think art is just so important, like you said, for our health and for everything else. One of the reasons we asked for a little more capacity was to be able to put together a good business plan for next year. And that's really is the goal, is to be able to have the capacity now to put a good business plan together, to be able to defend all those things that we're asking for. And we really do have, like Director Morrison mentioned, that, not siloed, but certainly all the disparate areas that we've got, and they do need to have their voice as well. And having those arts councils, being able to sit with them in their areas and talk about what they need. I think, we have their arts councils championing us in those areas as well. And they have connections. We talked about the number of artists, and 20% of professional artists live in BC. Of all of Canada, we have more artists than any other province because it's gorgeous. And so definitely that is part of that influence. We're going to be talking to those people, and we'll be talking to the arts councils, and there will be a full business plan coming forward.
Follow-up?
Yeah. Thank you, Chair. Yeah, and I think a good business, well, first of all, good answer. I think a strong business case is important. I'm thinking of like the Royal BC Museum when the reversal got changed there. It's sort of, I'm just curious because it seems to me that a lot of the focus happens in the city centers. Will you be going to Duncan City Hall in North Cowichan, potentially asking them for more money?
That's all part of the plan, right? I mean, when we get our capacity to be able to sit down and start working, the last year and a half has been nothing but preparing this plan. We haven't got, so we have this great roadmap, but now we need to be able to figure out how to implement it, who we need to bring on as more allies. I'm sure we'll be making presentations just to be able to talk about the plan, right? And being able to give that information. I think asking for money is probably going to be part of everything that we're doing moving forward. I mean, we have $130,000 that hasn't changed in almost 10 years. $5,000 now as a grant is not, what it was in 2017. We're underserving our community and we're undervaluing the arts in the community.
Thank you.
Mr. Elzinga, you look like you want to chime in.
Mr. Chair, if I could just add a point to that. So the CVRD obviously is based on functions, based on services, and so we're talking about two separate services here, 426 for the Cowichan Performing Arts Center and Function 400, which is a regional budget. And as was presented, you will see that within that regional budget, there has been some sub-regional or community initiatives, and I would certainly anticipate that to continue. Our finance staff keep us on track as to where those funds are kept. And as you saw in the presentation, that right now, 1.5 days per week are within Function 400. The rest of the time is within Function 426. And so the request is to move a half day from one function to the other. I just wanted for a process to let this committee know that that came up at the Cowichan Core Recreation Commission, because when we talk about Function 426, that's the jurisdiction that debates that budget, and they approved recommending to you as a committee that transfer of a half a day a week has already happened. So you will see that recommendation on December the 12th.
Thank you for that. I have Director Nicholson and then a follow-up from Director Acton online. So Director Nicholson, please.
Thank you very much. Thank you so much for this report. I am a strong believer that arts and culture is an important investment that we can make in our community to make it more. I mean, if you think about the community, vibrancy comes from the arts and culture primarily, I think. So yeah, I think it's super important. My question is about information. So about over 10 years ago, well, I've been at the board for 10 years, and so it was before that. I know I worked on a project to inventory cultural facilities and so forth. And there was a development, CowichanCulture.ca, I think was the platform that we used to provide people with an ability to advertise their events, but also to understand what was available. But that was never supported or those kind of. This is something that the strategy says the CVRD could actually really add value to the community, to be that coordinating, promoting agency that looks after something like that. So I'm wondering if you know about that, Patrick, and I'm wondering if that's something that you could revitalize or maybe do it differently or whatever. But I think it's super important because at that time it was a really important need. Thanks.
Yes, definitely. We looked at those old reports. We, have brought them in to be part of what we're doing. I mean, they are out of date, but they're a good roadmap. They're, some really interesting information to give us a head start. And those websites, it's kind of still around, but not really. But I mean, if we can revive and fix something that is already created, then that certainly is something that we want to look at doing. And having the capacity to be able to analyze. We've already started having some of the conversations with the people who are running those older websites. And so it's, it's something to build on for sure, but we have looked at it, yes.
Does that conclude, Director Nicholson? Thank you. Director Acton, please.
Thank you. Yeah, so I guess I feel like we're doing a really great job in Cowichan. There's so many great things going on, and our councils, arts councils seem really active, and there's events, and there's a few little spots we could improve on. But I'm just wondering, like, how do we compare to other? This is usually a municipal thing, so how do we compare with other regional districts to? That are similar in size, and are we funding, how are we comparing to their funding models?
We did. We looked at several other regions as well as municipalities. I mean, the CRD is certainly a lot bigger than we are, but they have some great ways of doing things. So they're, a wonderful big brother. We also looked at the Comox Valley. We looked at Alberni and the Caribou region as well. What we found, specifically compared to Comox Valley, for instance, they give away about $25,000, $30,000 more a year in grants than we do. We're behind some of the other areas, but like I said, our budget has not increased in, almost 10 years. So that's to be expected that we're going to be behind the others.
Thank you for that. I see no other hands, so as a retired thespian, I love that word. I know the benefits and the value of arts and culture within, especially small remote communities like the West End, for instance. It brings communities together to watch those productions and to view the art of those who reside within our lovely area, and that's why we have 20% of Canada's artists. I would not, as an artist, want to paint the landscape of Winnipeg as opposed to the landscape of Vancouver Island. And nothing disparaging to Winnipeg. I have relatives there, so don't chastise me. But the importance of that to a small community is imperative to a community growth. So thank you very much for your presentation.
Thank you.
And we have a motion. Would you like to read that, Ms. Boyd?
Thank you, Chair. That it be recommended to the board that the Arts and Cultural Master Plan be approved.
I have Director Douglas, Director Morrison seconding. All in favor? Opposed, if any? That motion carries. Thank you very much. Ms. Boyd?
We have no unfinished business. We have no new business. We move to question period. And not looking in the gallery, or looking in the gallery, there is, I'm not seeing anyone there. Motion to close the meeting, that the meeting be closed to the public in accordance with the Community Charter, Part 4, Division 3, Section 90, subsections as noticed, CSM 1, that's the closed session minutes of November 13th, 2024. CSR 1, personal information about an identifiable individual who holds or is being considered for a position as an officer, employee, or agent of the municipality, or another position appointed by the municipality.
I have a mover and a seconder. All in favor to go on camera under those conditions? In favor?